You're listening to the podcast When Life Gives You Lemons, presented by me, Emma Levy. Having worked with elite athletes for most of my career, it's always intrigued me that a significant number of high-performing individuals have encountered some form of adversity earlier in their lifetime. My fascination into this grew when I had my own brush with adversity. When I was diagnosed with breast cancer in May 2020, in the midst of the global pandemic at the age of 36. During this period, I questioned whether it was my positive mindset, or maybe something deeper, which enabled me to bounce back and to train and compete for a triathlon just 1 month following completion of all active cancer treatment. The goal of this podcast is to explore this concept further by meeting a variety of high-performing individuals who have experienced adversity, but who have come back stronger. Today I'm welcoming Dr. Philippa Kaye to the podcast. Dr. Philippa is a GP, best-selling author and journalist. Philippa is often seen on ITV's This Morning and various other TV and radio programmes, sharing her medical wisdom in a straightforward and easy-to-understand manner, whilst often dispelling medical myths. She has a particular interest in children's, women's and sexual health, having written multiple books on these topics, including Breasts, An Owner's Guide, The M Word, Everything You Need to Know About the Menopause, and Doctors Get Cancer Too. This is her honest memoir where she shares her journey of being diagnosed with bowel cancer, revealing how it actually feels to be sat on the other side of the desk and to be the cancer patient rather than to take on her normal role as doctor. Dr. Philippa, thank you for coming to talk to us today. I do really appreciate you taking the time out of your busy schedule and coming to the studio. Firstly, how are you now?
So this, I don't know when you go out live or not, but this is the beginning of May, and I am currently sitting here in an abdominal binder after having surgery coming up to 2 weeks ago now.
Right.
So I am fine, but I think it's an example of the fact that people often assume that your journey is over when they say that there's no cancer, but that your journey doesn't necessarily stop.
Yeah, and you were diagnosed in May 2019.
In May 2019, I was 39 at the time, and I was an extraordinarily lucky pickup. And whilst it's not lucky to have cancer, it's very lucky that I was discovered when I was, because I didn't have the typical signs and symptoms of bowel cancer. And for anybody listening, those are a change in bowel habit. We all have a bowel habit. You might go 3 times a day. Someone else might go 3 times a week. Both of those are normal. But if your bowel habit changes and you go from being a 3 times a day to a 3 times a week person, or vice versa, and that persists for more than 3 weeks, that needs to be checked out. Any blood in the poo, on the paper, in the bowl, mixed with the poo, tummy pain, lump in the tummy, extreme tiredness and unintentional weight loss. So you're not trying to lose weight, but your clothes are getting bigger. So those are the typical signs, and I didn't have them. And my youngest was 4 when I was diagnosed with bowel cancer, and I have had 3 cesarean sections. And after my last one, I had some pain in my pelvis, and everybody said that is from all the scar tissue. You've had lots of surgery down there, because I had other surgery, and it's just scar tissue pain. So I didn't really think about it. And it was only a few years later, as the pain became more persistent, that I thought, okay, I need to do something. And I went to the GP and I said, I think it's this. And she said, yeah, well, I think it's this too. And we went to the gynecologist, and the gynecologist said, yeah, I think it's all scar tissue, and we can go and get some of that. But just in case your bowel is stuck to your womb, I'm going to need a bowel surgeon as well. And the bowel surgeon said, well, we should just do a screening colonoscopy just in case. And I remember I was annoyed because I didn't have the day to take off work to do the bowel prep, and then another day to take off work to go and have the procedure. And I thought, this is just a waste of time. And then they're all going to say to me, and now we just need to do the keyhole surgery anyway. And so I was a bit grumpy, and I went in, and I remember that they pushed the sedation into the vein, and I lay down on my side, hug your knees in the chest, and there's a camera right in front of you, like a screen in front of you. And I opened my eyes and I looked as he put the tube in, the endoscopy tube in, and the cancer was 8 centimetres up, so it was there straight away. And I knew exactly what it was. And I turned my head and I looked at the surgeon, and the surgeon's eyes came up to meet mine. And I knew straight away And then it was like the sedation hadn't worked at all. I was very awake. But so I was an incredibly lucky pickup, because when they then went in to remove part of my bowel the first time I had other surgeries, had you not known what you were looking for, you could have done a keyhole surgery, seen a tummy full of scar tissue, which I had, and not gone into the bowel.
Wow.
So although it's not lucky, it was a very lucky find, and it could have been an awful lot worse. And that's not to belittle what happened, but things could be different.
So do you feel quite grateful for that early pickup?
I feel incredibly grateful to that gynecologist. And I wrote to him from my ICU bed, actually. And he's somebody that was involved in my training a long time ago, and he delivered my first baby. And I wrote to him and I said, without you, I wouldn't be here. And I saw him a couple of months ago, actually, and burst into tears at him. So yes, I do. I feel that it was a very lucky find, and I'm grateful for that. But I think that people often assume about cancer that there's some hierarchy of it. That if you have chemo, that it's worse, or if you have radio, that it's worse, or if you're in ICU, or when we did it in the pandemic, or but actually everybody's experience of cancer is unique. And maybe you had a mole removed, and maybe that was 10 minutes in a dermatologist's unit with a bit of local. But when they told you that was a melanoma, that your whole world sort of rocked. So I don't think that any of this hierarchy stuff makes sense, that everybody has their own experience. But I am grateful that I was found. And now I needed, from a very early point, I needed to find something good to hang on to.
Yeah. And at what stage in your journey did you open up to the public about your cancer? Because being fairly high profile in the media, I can imagine that was quite difficult.
So not straight away at all. I was diagnosed in May 19, and actually I had to take 6 weeks off work after the first surgery, and then I worked throughout my chemotherapy. And then I had to take 6 weeks off over another surgery or whatever, but I worked throughout most of it. And so my patients didn't know either. They knew that I'd had something, and that was it. And as doctors, we are quite careful about what we give of ourselves. Because if you give all of yourself all the time and you tell everyone everything, then there's nothing left. So we are quite careful. And if you think about your relationship with your GP, you might know that they've got kids the same age or something, but you don't know what's going on with their parents or their lives. And the pandemic was unique in that your doctor was going through the same thing that you were going through, and that changed the dynamic somewhat. But I started writing a diary the day that I got home from that diagnosis, because I needed to emotionally vomit. And I could not stand being in my own head. It was just too noisy and too much. And so I wrote it out, and I wrote it out, and I wrote it out. And my diary never cried back, and never had any judgment, and never said you can do it, and never said anything. It just was the most non-judgmental thing that you could have. And you can repeat yourself 100 times and your diary doesn't get bored. So I wrote and I wrote and I wrote. And I had the first edition of the M Word coming out. And my publisher said to me, how are you going to manage the publicity and stuff? And I said, well, I'm just going to manage. And then she said that we were beginning to talk about it, and I began to talk about it with my therapist. So I've had therapy since my diagnosis, and I'm very open about that. And I realised that I have this platform, and I'm very grateful for it, and it is a unique space. But I was so lonely throughout my cancer treatment, incredibly lonely, even before the pandemic, because someone can take you to the doors of the operating theatre, but it's you that lies down on your own. Mm-hmm. And it's you that says over and over and over again, hurt me to make me better. Mm. And you lie there and they access your port and they fill you with cancer poison, right? And you say, do it to me, please. And no one else does that with you. And it's incredibly lonely. And I didn't want other people to feel so lonely. And I struggled initially with getting involved in the cancer community because I knew that when you come and see me as a doctor, you're mine. Straight away, you're mine, right? And we have this relationship now where I feel responsible for you. And in the cancer community, I started to feel responsible for too many people and wanting to fix too many people and needing to say, well, you could ask for this and you could ask for that. And I can't be doctor in that moment. I really needed to be patient. And so for a while at the beginning, I pulled back from the cancer community in general. But what I realised was how much I could do for that community, but also for, I guess, everyone. 1 in 2 of us are going to have cancer. That means everybody knows someone who's affected by cancer. And I wanted people to know what not to say, never mind what to say, but what not to say, because there's an awful lot of those. And I am very aware on the television that when I talk about bowel cancer, it takes about 3 weeks to a month, and my DMs get full. And the reason it takes that long is because people then go and see their GP. There's a 2-week wait to see the hospital doctor, and they get a scope and they tell me when they've got their diagnosis. And then they begin to write to me saying, I saw you on X a month ago and I went because I didn't know that bleeding was this. And that's incredible. And we know the data shows us really clearly that when, for example, we do a smear on telly, that the number of bookings goes up. And anything that I could do to stop other people being in this position, I feel very responsible to do. So I decided that I would publish it, and then absolutely freaked out about it. Because I write books which are for lay people about health. I don't write books about myself. And an editor has never taken a red pen to my thoughts before. And along came an editor that I had worked with before and I knew very well, and she started crossing out my thoughts or saying, do you think you could expand here, or is this in the wrong order? I'm like, what do you mean? Those are my thoughts. You can't, like, literally your thoughts are something that you can't control, and you're trying to not change them but edit them. So I found that really difficult, and I found going back over it very difficult when I was still in it.
I'm sure. So
it was hard, and I was very nervous about it, and the response has been absolutely delightful.
Yeah, and it's so amazing what you've done for awareness. But before you opened up about it, I think I read in your book that you were talking about cancer screening programs on the TV or on the radio, and specifically about bowel cancer screening programs whilst going through your own bowel cancer journey. That must have been so difficult.
That, yes and no. Because in that moment, I go very much into doctor mode. And to me, doctor mode is a very safe place. It's where I live. And I can do that. And it's some things in medicine you are trained to do over and over and over and over and over, like Pavlov's dog almost, you know, and you think, oh gosh, it's time to do my basic life support again. But you need to do those things so often that when the time comes to do it, there is no, I mean, there's obviously thought, but that it's an automatic response. And so for me to slide into doctor was okay. It's when I allowed patient in, when I allowed me in, that I struggled with it.
Yeah. And in your book, you talked about having a wall.
Yeah.
And how as a doctor, you need that wall. And I think you said to protect your heart and protect your soul. And then when you got diagnosed, the wall went up even further.
Yeah.
And that's to obviously protect yourself from the ramifications of having cancer. But is that wall still up? And if so, how have you dealt with the emotions surrounding your diagnosis?
It depends on the day, I guess. So the wall is not necessarily a bad thing. So people think doctors are hard or that doctors aren't caring. Doctors, they care too much. we're empaths most of the time. And we are very aware of what we call the transference, so the feeling that we get from you. So if you come in and then I feel quite edgy afterwards, I've picked up on a tiny bit of your anxiety or irritability or whatever it is. And if that tiny bit that I now feel is amplified in you, it gives me an understanding of what's happening to you. And that's a very psychotherapeutic term. And then the countertransference is that idea of what you get back from me. So the wall is important in the same way that you don't go to work in your pajamas, and that people at work, they call me doctor, and all of that is part of the wall. And I think that when physically you are flawed, sometimes you work harder to protect that wall, and sometimes it's just all out there and you have to rebuild it brick by brick. And therapy has been my safe space and my saviour for a long time now. And it's not that we all don't sort of therapize, that's not a word, counsel each other. We do. You give your friends counsel and your family counsel all the time. But a therapist does not show their emotional reaction and does not tell you what to do. They allow you to come to your own feelings about it. And I really struggled, and I still struggle, with people telling me how strong I am, how brave I am, people telling me only 4 more chemos, only 1 more chemo, only 1 more surgery. I've been told only 1 more surgery for about 8 surgeries. People who are so desperate for you to be well and are so hurt by the pain that you have that they can't bear it. And so they try and make it better. And they try and make it better by telling you to be better. But what I need, or what I needed, was to marinate in the shit a little bit. And I needed you to sit with me in it. And most people can't.
Yeah.
And a therapist often can. And so when people say, oh, you're positive, I'm not positive. I am pissed a lot. And I am grumpy. And I went to chemo stomping and dragging my feet, but I went anyway. And people really struggle with the idea of more than one thing being true at once. But more than one thing is often true at once, and feelings aren't black and white, they're grey, and you have feelings and not feelings or. So you can be brave and terrified, and you can know that you're going anyway and be stoic and be hugely angry about it, or be really fed up about it. And often people really struggle with the dichotomy of that, but you aren't or, you are and.
It's that comment, isn't it? You'll be okay. Because
You don't
actually,
know that.
you might not be.
Yeah.
Yeah.
And what would have helped me is someone saying, I hear that you're afraid. In fact, that still would help me. I hear that you are afraid, and I can't tell you it's going to be okay, but I can tell you that I'm here.
Yeah.
And it's really hard for people to do it. And as a doctor, my job has always been to try and fix. And I might try and fix with medicine or with therapy or with surgery or with me. Often, doctor is medicine, often. But cancer has really changed how I do that. And I know the exact moment that it changed. And that was in ICU after my first surgery, where things were going not well. And I would look at my own heart monitor and think, someone's coming now. I mean, in ICU, you have a nurse with you the whole time, but, the doctor's coming now, they've already called, and I know that I need X, Y, and Z. And the patient part of me would think, oh, I'm going to die now. And a doctor came in about 2 or 3 in the morning, and he looked at the monitor, and he sat down on the bed, and he held my hand, and he said, you're having a really shit time. And I don't know how long that lasted, but I know, and it couldn't have been long because he had to do what he had to do, but that was the time when, in that just moment of human connection, that I felt seen. And so now, when my patients, it always makes me upset, when my patients are going through something, And often they won't look at you and their eyes go down and their head goes down as they're talking about it. And I say, I see how bad it is. I see how hard it is. I see you. And their heads come up and their eyes meet yours. And you think, that's what I did for that person today. Because I can't always make it better.
Yeah. So has your cancer experience changed you significantly as a doctor?
Yeah. Yeah, I mean, and that would be what I think the difference is. I think the being in the public profile is slightly strange still, because patients know this piece of information about me and they will say, but what happened to you? Or, I've spoken about the fact that chemotherapy put me in a premature menopause, and they say, but what are you on? But what I'm on and what my treatment is not what necessarily what you need. So I can't... People are saying sort of, what would you do with the understanding that I have? And it's like, it's not what I would do, it's what would I do in your situation. And anyway, it's not about what I think, it's about what you think. And after I've given you enough information to try and make those choices and decisions yourself. So it is odd that people sort of know something about me in that way. But I think, I hope that more good has come out of it than not.
And have you had patients with the same vulnerabilities, the same fears as you, the same diagnoses as you?
I don't think you need the same diagnosis as me to have the same fear as me.
Yeah.
I think.
But have you had the situation where you're sitting as a doctor and you're thinking, oh my God, this is hard because this is me?
But that's not the first time, because I had recurrent miscarriage and when people would come in with miscarriage, or whatever else. It's the times when you identify with someone, and often that would be a young mother with young children. And I was literally just thinking about this today, of thinking, when your doctor cries as a patient, what do you think? And
do you often cry then?
Not often. But when I was a junior, there was a sort of leave the ward, and every junior I've ever met would say there was a time where they went and cried in the toilet. And I worked in oncology, and we did astounding stuff, like a woman got married on New Year's Eve and she died the next day, and we did it in the ward, and we did this stuff that was both heartwarming and heartbreaking. Yeah. And that you would leave sometimes the ward round and take a minute. And then in GP land, it's different, because in GP land, I know you, and I know you for years, and I might know your family, and I know where you live, and sometimes I look after generations of people, and so that relationship is different, and that's the joy of general practice, and what I hope can still be maintained in general practice is getting a lot harder. But you know people for longer, so they touch you in very different ways. And when I first started as a GP reg, I used to say to my trainer, but what happens? I can't excuse myself. I can't, because you're in a one-on-one situation. It's not like you're in a little group of doctors, in a whole ward. And she said, well, we can talk about that. What is it that you think? And sometimes, depending on how well I knew them or not, I would say something like, oh, don't worry about me. When people cry, I feel that too. My eyes are just leaking. Ignore me. Carry on. This is about you, not about me. Yeah. And so I will often say something like that. And I wonder, and I still wonder, does it make people think my doctor is human? Or does it make patients worry about me because I don't want them to be worrying about me at that moment?
I think the majority of patients would feel my doctor is human and they get me. They understand, they're empathizing with me. But
no one's ever complained.
Exactly.
No. And it's making it sound that it happens a lot. It doesn't happen a lot. But when it happens, I actually think as a doctor, it's quite important to take a moment and think, why? What is it about that has got in, that has got through? In the same way that when you start off as a doctor, you think a lot and ruminate a lot about cases. And the more experience that you have, the ones that you're thinking about at home are the ones where something bad is happening. or you're missing something. And you learn to look and think, oh, this person just keeps coming up in my head. Something else is going on. Let me go and talk to another doctor about it, or whatever. And I think it's really important to be aware, what is it about that person that triggered something in me?
Yeah. And do you think doctors in this country are prepared enough with how to deal emotionally?
You don't even need to finish the sentence. No,
Yeah.
absolutely not. There is no psychological support throughout your training. There is no psychological support.
Is that still the case? Because I know so I trained as a physiotherapist, and I know as a physiotherapist, you know, we're on the wards, we're seeing death as well, and difficult scenarios. I trained 15 years ago, or over 15 years ago. We had nothing.
Yeah. So
I don't know if it's changed though.
There's something called the Practitioner Health Programme, which that you can be referred into, but there isn't when psychotherapists train, they have to go into psychotherapy. And the only job out of all my jobs and training where I had to have some kind of counselling was when I did psychiatry. And so for 6 months, I saw somebody once a week, and that was part of the training. Aside from that, no. I was 24, and on my first day, I remember my first call. Everybody remembers their first crash call. I remember thinking, would it be better if I hide in the toilet? And my SHO, so at the time we were what's called PRHO, so that was the most junior doctor, which is now the foundation doctor, and then my SHO, which is now an ST doctor. And he looked at me, and there was this sort of thought of, and he went, come on, let's go. And we bolted down the corridor at St Thomas's Hospital to the psychiatric unit. And I remember exactly what happened in that first crash call. And afterwards, the registrar went, all right. And I went, all right. And that was that. But actually what happened was pretty traumatic. And we are exposed to situations where it's very clear that there are many situations which are worse than death. And all doctors will tell you that there are situations which are worse than death. And you're often on your own, and you're young, and you are exposed to all kinds of things, and you are exposed to the best of people and the worst of people, and you find your way, but there really does need to be more support for doctors, and an understanding of the humanity of doctors, because you can't absorb everything. But I know very clearly that when Adam Kaye's book came out, his first book about his time in obs and gynae, I read the book, and
this is going to hurt.
Yes, yeah. And a box got unlocked in my head, a box about cases that I had seen on the labour ward. And the labour ward, do you remember the advert? I think it was for for the FA Cup or something, and it said heaven and hell is the same place, and it was someone on their knees holding up a cup and someone on their knees with their head in their hands on the two opposing teams. And in labour ward, that's the same. On labour ward, heaven and hell are the same place. Either it's okay or it's bad. And when I read that book, the box got opened, and I dreamt of patients and scenarios that I hadn't thought about in a long time. And very clearly I had put them in a box. Yeah. And it's not that I was spending all my time sitting on that box, but reading that book opened the box, and I couldn't watch the programme.
Really?
Yeah. And eventually I did, but sort of in a prepared way, thinking I know that the box is open, as opposed to it coming up to you. So I think that doctors definitely need more support. All healthcare professionals do. There's no money for anything.
Yeah. But we don't want all doctors having to go through the traumatic things like that you've had to go through to better you as a doctor. Well, actually, I'm not saying you weren't a good doctor beforehand either. But sometimes going through that, and you become more self-reflective, and you maybe do become more empathetic. Or
your wall goes up.
Yeah.
And a bit of both has to happen. You don't do chest compressions on a little old lady and feel their ribs breaking and think about it at the time. You don't. You have to have your wall up.
Yeah. But you have to know when to lower that wall as well.
Yeah.
And that's the tricky
And
bit.
yes,
We've all seen doctors who don't lower that wall at all, you know,
and don't understand what it is from the patient's side. And I think that the balance is very difficult. And I think that people often talk about groups of doctors as one way or another, and they say, oh, the peds doctors are nice, but the surgeons aren't. And you think, well, it takes a lot of guts to put a knife to someone and say, I'm going to use this knife to make you better. And so I want the person cutting me to be the best cutter. And if they are a bit arrogant, maybe they have to be in some way. And I know that I can get the rest from somewhere else, but not every patient can. And it's very different. The balance is very difficult.
Yeah, absolutely. Talking about therapy, and something else I want to talk to you about from your memoir is you write about your psychotherapy and how she highlighted, and one of the things she highlighted was that you are not good at self. And you are a giver, and you see yourself as a mum, a doctor, a daughter, a sister, a friend. And I wondered where you are at with that now, because I had another guest on this podcast, the Paralympic gold medalist David Smith, who said the same thing. And he said his psychologist had advised him that he's not an athlete, he just does sport. Because when he had his spinal tumour and he couldn't do sport anymore, the mental health implications of that was so great. Yeah. So I wondered where you were at with that.
Well, so I've had a lot of therapy now. And sometimes it feels like you're not anywhere, and sometimes it feels like you've made progress. And I have made a lot of progress. I understand from an academic level it's not my fault. I still feel sad when my kids are affected, but it's not my fault.
Did you think it was your fault at one point?
I felt that it was my fault. Yeah.
Were you able to rationalise that? Or was that a totally irrational thought?
So I'm. My defence mechanism will always be to go academic, because that's where I feel comfortable. So I would say on an intellectual level, I will understand that I didn't ask for cancer, and I didn't smoke, and I didn't drink, and I didn't, and I exercised, and I didn't eat a load of processed meat or whatever it is for bowel cancer. And then they would say, well, actually now we found a gene, and they would say, it's not your fault. I said, what do you mean? It's my genes. My genes that I might have passed on to my child. So it's definitely my fault. It isn't. I didn't ask for it. It isn't my fault. So I understood intellectually, but I still really felt guilty about it. And that flares up, actually. And I have to... Well, I know that when something's flaring up, when I spend a lot of time in my head telling myself, it's not your fault, it's different this time, or whatever it is. I am much better now at understanding the core of me. And that I am enough. I never thought that I was enough. I never thought that I was good enough. And perfect is not something to aim for, actually, because you're always going to fail. Good enough is fine. But the pandemic and having a huge surgery in the pandemic, I was in ICU for 10 days on my own. I was in hospital for 15 days on my own in the pandemic. And it showed me that I am strong enough and I can. I just don't want to. And so when I had this surgery, for example, it's very triggering, obviously. And it was never that I thought that I couldn't do it. I know I can. That's the bit that I've learnt. I know that I am enough, and I know somewhere very down deep that I'm enough. I just don't want to be enough. And that's the bit that I'm struggling with. I don't want to still have to be strong or be whatever. Because when you are physically hurt, you hurt mentally, and you don't feel strong at all. You feel weak. And people telling you how strong you are isn't very useful. So I have a better understanding of self, but my self is often still defined by not necessarily what I do, but who I am. So I am a doctor, which is a very core part of my being. And I worked really hard for cancer to not take it away, because it comes for everything. And I wasn't going to let it take it. But what is the core of being a doctor? Well, that's caring for other people, and you can do that in lots of ways. And so trying to think about those kind of things. But cancer comes for your body, but really it affects your mind. And when your body heals, the mind takes an awful lot longer to heal. And when you're really unwell, you don't have any energy to do that, because everything that you have subconsciously is focused on getting better. And so when I look back at my time in ICU the second time, I don't remember thinking very much at all. I remember thinking, get this tube out of my nose, I'm just continually vomiting. But I don't remember thinking very much about lots of things, apart from there are particular moments that are very much stuck in my head. But there was no space to think because I was too sick to think, if that makes sense. And then
or
it's
you've
only
blocked it out as well.
Yeah, but it's only as you get better that there is time and space to begin to heal from a head point of view.
Yeah. So you've spent a lot of time on healing psychologically as well as physically.
I think that everybody does. They may not just be quite as aware of it. And I know I have to be very aware of it because I have to make the time for it, because my jobs are such that I go back to back to back to back, and I have to be very careful about it. So I know that when my oncologist said to me, if you exercise regularly, you will decrease your risk of cancer recurring, and a new one, because my genes haven't changed. So I still have a double risk of getting a new bowel cancer, as much as chemo will. And I thought, well, I'm about to start 6 months of chemotherapy, and you're telling me that I can get the same again by exercising. And so now the angel and the demon sitting on my shoulder, they're no longer there. I do that. I just exercise, and it helps me stay sane, because it helps me say that you're still doing everything that you can to not be in this position again. And I know that, and I know various other things that I need in order to be a good mother and a good doctor. And so you have to do those things, and those things aren't selfish, they're necessary.
Yeah, essentially we can't look after the people around us if we don't look after us as number one.
Doctors are really not taught that. Doctors are only taught about presenteeism. And if you aren't there, then the rota's going to fall apart. And or someone else has to cover for you. And doctors go in sick, and we go in before we should. And I still do that. But I'm getting a bit better.
It's a process. So do you see, this is a hard one, but do you see the positives that cancer has brought yet? I see, it's funny, I almost can't quite remember before. I know there was a before. Obviously there was a before, but I can't quite remember and imagine it, if that makes sense. And that's because we don't talk about the impact of being a survivor and survivorship. If one or two of us are going to have cancer, more and more of us are living with cancer or are surviving cancer. But we don't talk about lymphedema from breast cancer surgery, or premature menopause and infertility from chemotherapy or radiotherapy. We don't talk about the mental health issues and the ongoing fatigue. We don't talk about low anterior resection syndrome. I only have half a bowel now. I can't queue for the toilet. And how sometimes I can't get out of the toilet. How my diet is entirely changed, and I still get a third to a quarter of my diet from supplements. Not like vitamin supplements, actual calorie supplements, because I cannot eat the volume of food that I need to eat, and how that impacts every decision when people go, let's go out, or you're out for the day and everyone else is grabbing a sandwich and I'm still taking something with me. And we don't talk about those kind of issues which are lifelong, or nerve damage from chemotherapy, or whatever it is. And for me, that's something that definitely needs to be talked about a lot more. Would you like everyone around you to know that about you then?
No, I want the people who I want to know to take it into consideration, but I don't want them to tell me about it, and I don't want to make it too obvious. It's very confusing.
Because I don't want to talk about that. Do you know what I mean? I want to still be that strong person.
So I would like someone to not say something stupid, and they do all the time because it's not part of their lives, and so they don't think about it. So when they look at my plate at a dinner or, a function, and they go, "Oh, you're on a diet? Oh no, but you look really good. You lost loads of weight when you had chemo." And I think, well, A, don't comment on anybody's body. B, losing weight because you're on chemo and are sick is not a good thing. And C, you're trying to be nice, but it just shows that you don't think about what's happened to me. And so I struggle with that kind of thing. I see that cancer has changed me, and I accept that. And I think that that's huge, because to get to acceptance, you have to go through all the other feelings. And I don't think that you have to be positive about things all the time, but acceptance is some level of peace. And I think that is valuable. I would love to answer that question in 5 years when maybe I'm out of it.
Yeah. Interesting you say that, because I had a guy on the podcast last week who had leukemia 8 years ago. And he was an example of someone who said basically how pleased he was he had cancer, because he feels he is a better person now, and how it has enriched his life. And I at the time said, ask me that question in 5 years. And I laughed at the time. I said, I'm laughing thinking about the fact that you see it as a positive thing. So maybe you're right. Maybe time.
I think time, as GPs, we use time all the time. And we say, come back in a week if it's not better, right? And we say, so we use time as medicine. And it's not concrete, but it does make a difference, because your life expands around what's happened to you.
Yeah. And in this podcast, we do talk about resilience.
Yeah.
Do you see yourself as a resilient person?
Now I do.
Did you not before?
Not sure I'd even really thought about it before. Before I relied on things like academics and things where I felt comfortable. And, I would work hard to be a good doctor. I still work hard to be a good doctor. We learn all the time. But I don't think that I realised at all that cancer is like getting punched in the face and standing up, and getting punched in the face, falling down, standing up, getting punched in the face, falling down, standing up, over and over and over and over again. And I no longer think I'm going to get punched and fall down. I think I know I can get back up. But again, I don't always want to. So I think that it has shown me about my internal resilience a lot more.
So
Definitely.
There's a positive that's come out of cancer.
There are lots of positives, I think, that have come out of cancer, including the opportunities to help many more people, which is a core part of my being as such. So I think that there are positives, and I think that my children and I, that's where I sort of will, as a mum, that's where my focus often goes. And I can even see with them, my children are empathetic. My children have shown me how resilient they are. They are caring. It's just still hard to balance the fact that they have to be.
Yeah, of course. But do you think you take that resilience into other aspects of your life? So not just your health, but, your work life, your social life?
I think that in some aspects of all, doctors are pretty resilient in general. But I think that if it's made me a better doctor, it's made me a better friend, it's made me a better lots of things, because you've had an experience that other people haven't. I think that cancer changes you, and I think that the idea of going back to before is never going to happen. And I think that's really hard to hear. You go to a new normal, a new version of you, and you can like that version and be happy with that version, but it's not the same.
Yeah.
And that's okay.
They talk about it as a loss, don't they?
Yeah, but you have to grieve a loss, and you have to be allowed to grieve a loss, and that's the thing that other people struggle with.
Yeah, but that's why I was asking you about your wall, your emotional wall, because, you know, the great Dr. Edith Eger says you can't heal what you don't feel.
Yes. Oh no. So the wall, I would say that my wall is made of Lego, in that it comes up and down.
Yeah.
And that's okay.
Yeah. And that's important.
Yeah. But sometimes that you need people who don't love you in order for the wall to be down. Because you're always aware with your friends and your family, or I am, of the impact on them. And the doctor in me never wanted to, still doesn't want to hurt them. And that balance of allowing them to help and allowing them to see, but that balance is still very difficult, actually. And so sometimes you're most vulnerable. It can be easier to be with someone who doesn't know you at all. But I think that what I wanted more than anything, and the pandemic took away, was the choice. And knowing that you're going to wake up and not have anyone there. That choice was taken from me. And when I walked into the surgery, so I have this thing where I walk physically into surgery, because the first time they came with the trolley and my surgeon was still there, because I was going to have to spend about an hour in the anaesthetic room having tubes and epidurals and spinals and whatever else. And he said, "No, Philippa, we walk in so that we walk out." Obviously you don't walk out of the surgery, but as in walk out of the hospital. And that was a blithe sentence that he's never thought about since, and I have carried around, inscribed on my heart. Yeah. You walk in to walk out. So now I always walk in. And at one big one, I walked in, and I knew I was going to be on my own. And the ODP, who's the anaesthetic assistant, was someone who was the anaesthetic assistant on the previous surgery. And I said to him, "I'm really sorry, I don't know your name, but I recognise you." And he said, "Yes, Philippa, I was here in whatever date, and you had blah, 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 and that was me." And I said to him, "Please, can I hold your hand?" And he held my hand, and when I woke up, he was holding my hand. Wow. I don't remember his name, but I remember him. Yeah. And so sometimes, the balance of needing that choice was taken from me. I would have wanted that hand to be held by my mum or my husband, but you still need someone. So you find a way. And what I think the mental switch that came to me was, it wasn't broken. I found a way anyway, right? I found a way around. And so when I would feel my body is broken or my bowel is broken, no, I'm finding a way around. So it's not that I'm broken. No. It's that I'm managing.
And so you are resilient, very resilient. Which strategies do you think you've used to get you to where you are today? So we've talked about psychotherapy. You've talked about writing, because obviously your memoir. Any other specific strategies which have really helped you?
So exercise keeps me sane. Yeah. Anything that gets you out of your head and into your body. So often that's being outside nature. For me, the mountains are a very special place, or by water or whatever, somewhere where you are focused on what is happening to your body, not what is happening in your head.
Yeah, I can fully agree. The mountains for me is like unbelievable.
It was an aim for me to crawl to, if that makes sense. But yes, so being outside often, rather like a baby, when they're crying, you take them outside and they stop crying.
Yeah, amazing. Look at this. Look at the clouds.
Yeah.
Final question: if you could go back in time to when things were their toughest, what do you wish you could have told yourself?
I have one regret in my life, and that regret is not about the toughest time. That regret is that in those few years when I had intermittent on and off bit of aching around my scars, that I didn't say, no, it's not scar tissue, because all bowel cancer grows from a benign polyp. And you can just take out a polyp at a colonoscopy and never thought about it again. And it's a silly regret because I can't go back and change it. But that would be what I would do and change. If I could go back to at the worst time, what would I say? Probably nothing. Just sit and hold my own hand.
Yeah.
Because you can't say anything. And that's what was missing in the pandemic, was that I had to hold my own hand.
Yeah, that was hard.
Yeah.
Where can people find you if they want to know more?
So you can find me on Instagram and Twitter at Dr. Philippa Kaye, 1L, 2 Ps. And all my books are available at Amazon, Waterstones, and anywhere else that you buy books.
Thank you, Dr. Philippa. Thank you for your honesty, your vulnerability, and sharing your story, and for sharing it so widely as well. I really feel that books like yours and sharing, like we talked about, awareness enables more people to get diagnosed early, and we know the importance of early detection. Please keep writing your fabulous books. They are very readable, and they really do help the layperson to understand these crazy medical concepts. So thank you very much.
Thank you for having me.